Osteoporosis today.
Yes. And I told them that I wish we could do a Mythbusters episode on osteoporosis, that we could be somewhere in a parking lot blowing things up or in a desert smashing the myths about osteoporosis. And I said the one of the art I took down a few quotes from you and your article, and one of them is that you take almost all of your patients off medication once they come into your office. That was a huge shocker to me.
Yeah, that's because they're all toxins. Well, not all of them. There's actually one that's not, but it's never used. So the ones that are used are all quite toxic. They so can I like give an explanation of what osteoporosis is?
Yes, and you know what? There's a question about, is it the same thing as osteoarthritis and osteopenia? And then maybe you can say how it works in your body.
Okay, so osteo means bone. So anything having to do with bones is going to be named osteo. So osteoarthritis means a bone inflammation in a joint, because arthra means joint. So it's the bone inflammation in the joint. So that's osteoarthritis. Osteopenia, penia means a little bit. So there's just a little bit of bone there, and it's just less. So osteopenia means you have less bone. Osteoporosis means it's porous, meaning there's a bunch of big holes in it. Well, big relative to what's normally there. So osteoporosis means there's big holes in it. Osteopenia means you have a little less than expected. And osteoarthritis is an inflammation of a joint. It's a type of inflammation that's affecting the bones and cartilage in a different way than rheumatoid arthritis, for example. So is that clear?
I think so. It was clear to me. Yes.
Okay.
Well, let's explain how holes get in the bones.
Okay. So that's the big issue of what osteoporosis is, because the bone is remodeling constantly. You have bones being broken down and built up and broken down and built up. And by broken down, I mean literally being taken out of commission. There's cells in your bone called osteoclasts that take the calcium out, and they take the protein out, that they digest away the bone, and so that there's less bone. Why? Is because what you want is a strong bone, and what you don't want is just a rock there, because rocks crack. And in fact, your bones crack all the time. You don't realize it, but walking around, you get little microfractures in the bones, and the osteoclasts then take out all the fractured part, and the osteoblasts then build it up to make it thicker than it was, so it's stronger than it was. So wherever there's these microfractures, they get stronger. And so what sometimes happens is people don't get enough calcium in their diet. Usually it's a vitamin D deficiency. So if you've ever heard of rickets, rickets was a well-known illness during the Industrial Revolution in Europe and even in the United States. And what people would get with rickets is essentially osteoporosis. Their bones would fracture. If they were children, they wouldn't get any calcium on the bones, but they would have the protein. So their bones would bend, and they'd have these characteristic bending of the bones because there wasn't enough calcium to stiffen and to make those bones stiff. And the reason that happened was because there wasn't enough vitamin D. And here's the way it works. Like, you have to get vitamin D from the sun, right? If you're not taking a supplement, if you don't have sunshine, you don't get vitamin D, period. If you don't get vitamin D, you don't absorb very much calcium from your intestines. So then you get calcium deficient. And then your body says, I need calcium, and it has to be constant all the time, because if calcium levels drop down, then the muscles don't work, the nerves don't work, things don't work well. So in order to make every nerve and muscle work well, you have to have the right amount of calcium all the time. So if there's not enough calcium, then, and you're not eating any, or you're not getting any from your intestines, you have this huge supply of calcium in your bones. And so the body starts taking the calcium out of the bones. It's perfectly normal and natural. It's, the whole thing is set up that way so you can have a constant level of calcium. So what happens is, if that happens, you know, occasionally, once or twice, or for a little while, you know, that's all okay. That's what's supposed to happen. But if it goes on for years, then what happens is your bones are getting thinner and thinner and thinner. You're getting less and less calcium in your bones. You're getting less and less bone. And so then your bones are getting to the point where they can break easily, especially as you age. When you're younger, the proteins your bones are a little more flexible because you have some proteins. So like children have sometimes quite bendable bones. But as we age, our bones get sort of less of the collagen and more of the stiffener, which is the calcium. So so as we age, we're more likely to get fractures from stressing the bones, as opposed to having them bend a little bit. They're less bendy, and so they fracture a lot more easily. Plus, older people are more likely to fall as they lose their stability and their balance. So for all those reasons, it's easier to break bones as you get older. And now, if you've been going for many years without getting very much calcium in your diet or absorption because you don't have enough vitamin D, then you have this problem of what's called osteoporosis. Well, osteopenia, if it's only a mild case, and if it's a severe case, it's called osteoporosis. And yes, the bones are more likely to break from that. So how do you prevent it? Well, getting enough vitamin D. You know, one of the funny things is I have tested thousands of people, literally thousands of people, and I could count on two hands the number of people who had normal levels, and most of them we knew why they had normal levels. One of them had, just gotten back from Hawaii, but some of them we don't know why. They just had normal levels, and they say, yeah, I go for a walk every day out in the sun. I don't know, maybe that's why. But anyway, it's very common to have low levels of vitamin D, and it's very uncommon to have normal levels of vitamin D. So over a long period of time, that's going to produce this osteoporosis. So what happens if you take a drug? What does the drug do? Well, the drugs are made to kill a cell called osteoclasts. Remember, those are the ones that reabsorb the bone, the little fractures in the bones. They reabsorb it, or they remodel it by taking out bone that's not needed anymore. So these drugs that kill the osteoclasts, they're permanent. Those osteoclasts are gone for good. So what happens? Well, the osteoblast can put calcium in the bones, but it can't take it, but you can't take it out. In other words, you can't remodel the bone. So you lose that ability to remodel the bone. So the bones don't get stronger. At first they do get slightly stronger, but then what happens is you start getting weird fractures, things that are unusual, like generally, like older people, when they fall, they get a fracture of, it's called an intertrochanteric fracture. It's a fracture right near the hip joint, where the neck of the femur is. But people who've been taking osteoporosis medications, they break the shaft of the femur. And the shaft of the femur is super strong. It's a really, really strong bone. And so you wonder, why the heck would it break there? Well, it's because the shaft isn't getting remodeled, but it's building up calcium. And the calcium without the protein is not strong. You actually need the protein in there in order to make it strong. It's kind of like fiberglass. If you know how fiberglass works, you have the glass fibers are really strong and bendable, but then you have to stiffen it with a resin. If you have just plain resin, the resin's okay, but it'll crack easily. And once it cracks, it just breaks. If you just have fiberglass, then it's really bendable and it won't hold anything up. But when you mix the two together, you have the glass and the resin. The glass makes it strong and a little bendable, and it can't pull apart. And if it cracks a little, it's not going to pull apart or break completely. That's what the glass does, makes it strong, and then the resin makes it stiff. Well, that's the way bones work. The proteins make it strong, and the calcium makes it stiff. So what happens when you take osteoporosis medications is you get stiff bones, but they're not stronger. So the way to handle this is to go back to why. Why did you get osteoporosis in the first place? Why did this happen? And if you look at over many, many years of not having enough vitamin D and not getting enough calcium, and your body taking the calcium that it needs from your bones, then it makes perfect sense what needs to be done. And number one, there should be some vitamin D, because that's a very common deficiency. Vitamin D helps you absorb calcium from your intestines, and it prevents you from excreting calcium in your kidneys, so the bladder. So then you have this extra vitamin D, you have this extra calcium in your body. But then you need another vitamin called vitamin K. And this is really important. Vitamin K takes that calcium and allows it to be stored in the bones. So then otherwise you can get calcium deposits all over the place. You can get calcium deposits in your arteries, in your joints, in your tendons and ligaments, and then you just get bone spurs all over the place. So in order to prevent that calcification of everything, the best thing to do is to get enough vitamin K. Where does vitamin K come from? Well, green vegetables primarily, and fermented products like fermented soy products is common, miso, natto, those kind of things have vitamin K2. Vitamin K1 is found in like dark greens like kale and spinach. So those kind of things are necessary. And since in our society we don't have any of those things that are a staple in our diet, lettuce doesn't have a lot of vitamin K, or very much at all. And so if people don't eat spinach and kale and dark green vegetables, then they may not be getting enough vitamin K. And that could be another issue where they'll deposit the calcium in their arteries and tendons and ligaments instead of putting it in their bones if they don't have vitamin K. So those two things are needed, vitamin D, vitamin K. So you'll notice one thing. People often ask this. In the synochroma, vitamin D is there because vitamin D is really important for being sensitive to the insulin. So that makes you more sensitive to your insulin. But then why vitamin K? Well, vitamin K probably doesn't have much effect on the insulin sensitivity, but it's important as you're absorbing more calcium for that vitamin K to allow it to be put in the bones. In fact, if people have calcium deposits and hardening of the arteries, they can soften their arteries and decrease those calcium deposits with vitamin K, just taking extra vitamin K. So that's why that's important. Even in your synochroma, we put it in there for that reason, and that's why it helps.
Yeah, we're getting all these questions about taking calcium for osteoporosis. Where can I get calcium? So calcium is not just the answer to osteoporosis. It's basically vitamin D and vitamin K.
Correct. Yeah. In fact, they did one study that showed an increase in women taking calcium, increase in their atherosclerosis, the calcium deposits in their arteries. So it's getting enough vitamin D and vitamin K so that it's regulating it properly, not just getting more calcium.
Right. Well, so one of the other quotes that I wrote down from your article was the treatment of rickets was vitamin D, and basically rickets is a mild form of osteoporosis. So the treatment of rickets was vitamin D, but the treatment for the same problem by a different name, osteoporosis, is a drug. That's the problem
Yeah.
with today's society. We just think a drug is going to take care of it when it's actually making it worse by
Yes. So
preventing osteoclasts from working.
right. So that's why people like if they've been on these drugs for osteoporosis and they get a tooth pulled, they get necrosis of the bone of the jaw, and they actually can lose their jawbone, and have to have bone grafts, because they can't remodel that bone because when the tooth is pulled out. So this is really important. It's not something that's a minor issue, and that's. So you mentioned, gosh, it was surprising that I take everybody off of those medications. Yes, these are poisons. They literally poison. They kill cells in your body that are needed for bone remodeling. So it's not a healthy thing. And it's not a benign thing. It's not like, you're taking a blood pressure medication. Okay, it won't kill you. It probably is not going to help, but it won't kill you. Whereas the osteoporosis medications, they actually do kill the cells, and that's their purpose, actually.
My myth blown one more time. So can you take synochroma for osteoporosis if it's got the vitamin K and the vitamin D?
Well, absolutely. Yeah, you're getting the vitamin D, vitamin K, and you're getting it in an amount that is useful for osteoporosis. So you don't have, if you're taking synochroma for diabetes, you don't have to add anything to that for osteoporosis. You're already there.
Yes. So let's see. Someone asks about creams that doctors recommend.
Yeah, creams are great. Vitamin D and vitamin K are both fat-soluble vitamins. And so they put them in a cream. They're absorbed through the skin. In fact, think of it this way. How do you make vitamin D in the first place? You have to have sunshine. It has to get on your skin, and then your vitamin D is taken from the skin and then goes to the kidneys and is made into the active form. So yeah, vitamin D, the creams are just fine. You don't always know exactly what you're getting. So if you're using the cream, I don't know that it matters a lot, but if you're using the cream and you test your blood levels, it may not reflect what your real levels are, because actually this has been shown, because vitamin D is a steroid hormone. Other steroid hormones like testosterone, estrogen, progesterone, when they're used in creams, and you measure blood levels, it doesn't reflect what the amount is in the body. If you do saliva levels, then you can. So, but I've never heard of a saliva test for vitamin D. That's kind of interesting.
Mm-hmm. So what about exercise in osteoporosis? Does exercise prevent osteoporosis, and is it a treatment for osteoporosis?
Well, I'm sorry, say that again. I missed
What
that.
does exercise do for osteoporosis? Does it prevent it, and can you treat osteoporosis with exercise?
Oh my gosh, I can't believe I forgot that. Okay, so I'm a biochemist and I look at things biochemically. And so I look at the hormone balances and the calcium and magnesium and all that stuff. But I cannot overemphasize the importance of exercise. Exercise, by far, the single most important thing. You can sit on the couch all you want and take all the vitamin D and vitamin K and take that synochroma. If you're not exercising, you're not going to build bones. Building bones requires exercise, because if you don't stress the bones, then the osteoblasts don't know to make more bone. You have to stress them so that it'll build up. So yeah, that's so important. In fact, when I wrote the article, I'm like, yeah, we should put exercise number 1. That's first. Wait a minute. We should put it number 2 also. No. Actually, number 3. So number 1, 2, and 3 is all exercise. And at the end, I emphasize that again.
Yes, I'm going to quote you again. Studies show that those who are doing significant exercise gained as much as 5% of bone in a year, whereas those who don't exercise or just walked comfortably lost as much as 5% of their bone mass. So if that's 1 year, 5%, 2 years of not walking, 3 years of walking, 4 years, that's 20% of your bone mass gone because you haven't exercised.
Yeah, that's huge. Huge, huge. Yeah, if you're not exercising, you can take all the pills you want. It's not going to work. Sorry. You got to get up.
You're not talking a casual stroll. You're talking about either hitting the pavement, I mean, in a good way, exercising or lifting weights, right?
Yeah. 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 You know, that's interesting. You have to think about it. You have to stress the bones.
Yeah.
If you're not stressing the bones. So casual strolling is not enough stress on the bones. And that was actually in the study where they looked at the difference between people who were doing significant exercise like jumping up and down, jumping jacks or running compared to a casual stroll. And it made a huge difference, 5% on versus 5% off.
So aim for that. If you can't do a strong walk yet, work towards it. Get out, start walking, build your bones, make it a progress. Or maybe do something like a trampoline. Would a trampoline help strengthen your bones?
Yeah. Anything that stresses the bones. So if you're doing like calisthenics, like you're doing push-ups and those kind of things, those work really well too. It's stressing the bones is very important.
Yeah. Okay, so I have a question. What's the difference between vitamin D and vitamin D3, since we're talking about vitamin D right now?
Okay, so vitamin D comes in several forms, and the active form, well, not the actually it's the inactive form, but the form that is made in our skin from the sunshine is called D3. And then that's 25 hydroxy D3, and then that goes to the kidney and is made into the really active form, which is the 125 dihydroxy form. So there's another form, vitamin D2, which actually comes from a fungus. It comes from mushrooms and yeast. And it's the one that is the prescription form. It works. It's about 15% as bioactive as the vitamin D3. So it's really a lot less active, but it does work to help absorb more calcium from your food and to prevent calcium from being lost in the urine. So it does work. But it's less bioactive than the D3. So I always emphasize the D3 because that is the natural form. That's the normal form. That's what your body makes from the sunshine.
And do you want to comment before we answer questions about diabetes about sunscreen and vitamin D?
Oh, good. Thank you. Yeah. So if you're putting sunscreen on, then you're absorbing those ultraviolet rays that cause the vitamin D. And the vitamin D is made actually in the cells of the skin, in the skin cells. And so if you're spreading sunscreen on top of that, then it's absorbing the vitamin D, absorbing the ultraviolet light, and it stops you from making vitamin D. So all of the things that they told you to prevent cancer are like avoid the sun, don't let the sun touch your skin. If it touches your skin, make sure you have sunscreen before it touches your skin. Well, if you do that, you'll never make vitamin D. It's not possible. So think about this. What could the dermatologist do differently so that you can get the sunshine? Because the sunshine has a lot more effects than just making vitamin D. The sun, the light from the sun turns on mitochondria in your body. There's a whole bunch of things the light from the sunshine does. So sun is important, and it's important that it touches your skin. So what else could you do to prevent skin cancers, because the sun can create skin cancers? Well, you don't have to be out in the sun for hours and burn. It only requires about 20 minutes to make enough vitamin D. In fact, one study showed that in 20 minutes, you could make about 25,000 units of vitamin D with a significant exposure of your skin. So, we're talking a lot is made from the sun, a lot. And compared to the supplements, we're looking at, 1,000, or Synachroma has 5,000. You make 5 times that from the sunshine. So just to give you an idea where things are. So the other thing that can be done that dermatologists can say instead of avoiding the sun is if you get a lot of antioxidants, a lot of beta carotene, carotenoids, and zeaxanthins and astaxanthins, they protect your skin. So they give you protection from underneath from the cancers while allowing the vitamin D to be made. So having all of those blueberries and kale and spinach again, here we are again, same place, right, of what you eat, really does protect your skin from getting skin cancer. In fact, it's measurable. You can, there's a group that has a machine that you can put your hand in there and measure how much carotenes, beta carotene you have in your skin. My wife did it, and she puts she eats like kale smoothies, spinach smoothies, and she puts blueberries in them, and she had a super high number. It was like double mine. And so it makes a difference. If you're eating those foods, it makes a difference, and that will prevent you from getting skin cancers, even when you are exposed to the sun.
So I mentioned maybe in this webinar before, there is an app called D-Minder Pro app, and it you put in where you are in the earth, and it tells you how much time you need to absorb good vitamin D and what hour of the day. So you're avoiding the high intensity days, or maybe the rays are more damaging. And so if you're worried about getting skin cancer, just following maybe this app's recommendation, that if you sit out, if let's say in the northern part of the country for 30 minutes, but in the southern part, you may only need 10 minutes, that'll help you optimize your vitamin D absorption without too much exposure to the sun.
What a great idea.
Yeah.
Love that.
Meg S. asked a question about vitamin D. I keep saying we're going to move on to diabetes, but this is such, to me, a fascinating subject. What are the upper level recommended? What are the upper levels recommended when supplementing with a D3 and vitamin K2? And do you need a good stomach acid to release the vitamin K from the dark leafy greens?
Okay, very good questions. In order to, vitamin K is a fat soluble vitamin. So what you need is not acid so much as fat. So it's a good idea to eat it with fat. So eat your vegetables with fat is good. And we talked about before avoiding the starch in the fat, but eating your vegetables with fat. And that's a good idea. So that's the release thing. The levels or the amounts that you get are highly variable. It's kind of like going out in the sun. You know, one day you make 25,000 units, another day you make none at all. And that's okay. But since I've tested thousands of people and the ones that are supplementing, I find between 5,000 units a day and 10,000 units a day gets them into the really good range. And it's really hard to get toxic, but I had somebody taking 50,000 units a day, and her level was only 120, which is over 100 is considered high. And her level was 120, which really isn't that high. And she had no symptoms from it. And the symptoms of vitamin D toxicity are hypercalcemia. So if your calcium levels get too high, you get cramps of your muscles, and there's usually nausea, vomiting associated with it. So then that's toxicity. And in a sense, it's just too much calcium is really what happens. So you drop the D levels down, then you don't absorb so much calcium and you don't overdo it.
No, it's fine. Yeah. So we have an anonymous attendee who's going to sort of transition us more into diabetes, because he asks about synochroma. Does taking synochroma help heal bone spurs? Or what could be done to help my 52-year-old husband, maintenance man, constantly on his feet?
Oh, okay. Healing bone spurs. First of all, get rid of the inflammation. So inflammation causes calcium to start depositing in places. And that usually happens when the tendons they tear away from the bone and they don't heal properly. So that creates kind of a chronic inflammation in there. It's called an enthesopathy or tendinopathy. And then the calcium starts depositing. So the pain doesn't come actually from the bone spur. The pain comes from the inflammation, which also causes the calcium to be deposited there. So it's kind of like the looking at the cause and effect, what causes what. There's an association, but not causation there. So getting rid of the inflammation is number one. Number two is to get enough of the building blocks of cartilage and collagen. So some people take bone broth, for example. Drinking bone broth every day gives you those building blocks. Getting a lot of vitamin C. If you add a lot of vitamin C, number one, it gets rid of the inflammation. Number two, vitamin C is necessary for collagen production. And then as far as the bone spur itself goes, which is not the cause of the pain, but you can actually somewhat decrease that by taking vitamin K. Vitamin K takes calcium out of tissues and puts it in the bone. So that's one of the things that helps. So yeah, taking extra vitamin K. So your question of does Synachroma help that? Somewhat, but it's not going to fix the problem without getting rid of the inflammation that's initially causing it.
Today's Fixed Blood Sugar webinar is sponsored by Synachroma, our best-selling advanced blood sugar support formula. Now, thousands of people around the world are taking Synachroma every day as part of their program to fix their blood sugar using natural ingredients that simply work. Now, Dr. Saunders formulated Synachroma to meet key nutritional deficiencies that most people have unknowingly suffered from for far too long. With Synachroma, you get a blend of 6 key ingredients. The perfect combination of chromium, vitamin D3, and vitamin K2, which it's important to take those two together, selenium, vanadium, and our 10-to-1 cinnamon bark extract. Now, if you're not already using Synachroma, I highly recommend that you give it a try and see how it helps your energy, your weight, and your blood sugar numbers. You can get Synachroma at bartonnutrition.com or on Amazon. If you get it at bartonnutrition.com, you can enter the coupon code webinar25 and you'll save 25% off at bartonnutrition.com. But I realize some people like to go to Amazon as well. So anyways, Synachroma, highly recommend. Now let's get you back to the Fixed Blood Sugar webinar.
All right, next question. I have 2 diabetes and have bought all the supplements to help reduce my blood sugar. I'm at the end of phase 1 and my blood sugar is still over 120. I've dipped under 100 only twice. I'm only doing 20 carbs a day. Should I continue phase 1 until I get under 100 consistently or move on to phase 2?
Oh, don't move on yet. No, don't move on until you're consistently under 100. Yeah. That's really important because that's how you know your insulin resistance is down. And so if your insulin resistance is not down, there's a couple of things you can do. And that's when you're on phase 1, look at the fats. If you're eating a lot of fats in your diet, especially if there's some kind of mixture of fat with carbs, then that may be making you more insulin resistant or make it more persistent and not allowing you to easily get it down to normal. So one way to do that is to exchange fats, take fats out and add in more fiber. And that should make a huge difference. And adding in more fiber would mean like you'd have, instead of meat, you'd have a salad kind of thing or broccoli. You know, broccoli has as much protein as milk, or actually more than milk ounce for ounce. So broccoli is not low in protein, but it is very low in carbs and it doesn't have any fat. So you're getting the protein without getting either the fat or the carbs. So things like, cabbage and broccoli and cauliflower and I'm naming all cruciferous vegetables, but celery, and there's a whole bunch of vegetables out there that are great, bok choy and all that you can eat, and you don't have to add fat to them. So if you look at your fat, and you may find it'll just go down really easily down to normal if you don't have the fat in the diet.
So nowadays everybody's doing so now we have almond milk, oat milk. Do you think we'll have broccoli milk in the future? If it's I don't know about that.
No, I don't see that ever happening. I put broccoli in a smoothie once, and it was blah. I couldn't drink it. It was bad.
surprised they haven't made cauliflower milk. Everybody's on a cauliflower kick too, but I can't imagine that being really good.
That might be better than broccoli.
Yeah, maybe. Okay, here's a question from Durban. My coach is having me take Healthy Gut, Lean ACV, Cinechroma, turmeric, and iodine, everything, because I have 100 pounds to lose. I seem to be really tired and slightly off balance sometimes. How long with the energy kick in and I start feeling kind of normal? How long will it take the energy to kick in? I've been on my coach's program for about 3 weeks. I'm also using the spray magnesium, but because it's making me itch, I may switch over to tablets. What would be the dosage for tablets?
Okay, tablets would be about 400 milligrams a day-ish. Sometimes the magnesium oil, the spray on the skin, causes dilation of blood vessels because that's what magnesium does. And some people get itchy skin from that, and so you just have to take it orally, and that's okay. That's not a problem. And then what was the other question? How long the coach?
Taking Healthy Gut, Lean ACV, Cinechroma, and turmeric, and she's still feeling really tired and off balance. So she's only been doing this for 3 weeks. So when will it all kind of kick in and she'll start feeling better? And she's got 100 pounds to lose.
It's highly variable. I had somebody do a bone broth cleanse a few weeks ago, and she came back and told me, I did 3 weeks drinking just bone broth. I lost 25 pounds. But the entire time I was on that cleanse, I didn't have any energy. Now, when I'm eating, I have energy again, but I don't want to gain all the weight back. So we discussed that. But all 3 weeks, 20 days she was on the cleanse, she didn't have energy. And so some people don't switch from sugar burning to fat burning really well or really easy. And they just don't have a metabolism that burns fat easily. So she was able to do it. She burned a lot of fat and she lost 2 inches off her waist. So I know it was fat and belly fat that she lost, and it wasn't muscle that she lost. So she was burning fat, but she didn't get a lot of energy from it. So some people, and I know other people that are the same way, if they're not eating some carbohydrates, then they won't have energy. So those kind of people, I tell them that one of the things that you can do is to do intermittent fasting or do a cleanse or a detox program for a little longer, and just like suck it up and go through the process for a couple of weeks, lose the weight, get your insulin resistance down, and then you can eat normally again. And then you just do an intermittent fast, like every once in a while you do 3 days or something like that to keep things normal. But then you can eat anything you want. You wouldn't have to stay on a specific diet. Otherwise, you could just muddle through and keep going, because sometimes it can take several months on phase 1 to get your energy and find your optimum level of carbohydrates and proteins and fats.
And maybe try exercising, Connie. Not sure if you're doing that. We've talked about the importance today for your bones.
Good idea.
Yeah. Okay, let's see. A diabetes metabolism question from Krish. Does milk thistle intake help maintain a normal liver function?
Some people, there are certain things they don't detox well, and if they take milk thistle, it really kickstarts the detox of the liver, the glucuronidation detox pathways. So for some people, it's great, and I've tried that. And sometimes if you've done a test and you find like your bilirubin level is a little bit elevated, instead of 1.2, it's like 1.4, 1.5. And so the little red flag comes up that says, oh, your bilirubin level is high. And your doctor says, that's nothing, don't worry about it. Well, it doesn't mean anything by itself. It's not really toxic. You're not even going to see yellow in your eyes until you're, 3 or 4 times that. But still, still, it may give you a clue that milk thistle would be something you could take at least periodically, like a week on, a week off, to induce that pathway of detox. So you could, and people I find who it helps other things too. Something like alcohol, for example. Most of those people, I ask them, do you tolerate alcohol? And they go, oh no, I take one drink and I'm sauced, and then I'll have a hangover for 3 days, because they don't detox quickly. And then milk thistle helps that too. So milk thistle can be very useful for those kind of people.
All right, Vicky asks, I've lost 40 pounds, but A1C is 5.8, not low to 5.6. Please advise. That's kind of
oh my gosh, you did great, and you're asking my advice. You did.
You're almost there.
Yeah, you did something amazing. And 5.8. That's non-diabetic, by the way. It's pre-diabetes, so it's really. That's amazing. It's amazing what you've done. So I would say keep going on that, or play around with it a little bit. Find out what, if there's anything in your diet that's like raising things up. Like if maybe you're sensitive to fats and you're eating too much fat that's making you insulin resistant a little bit. But you are non-diabetic at this point, so good work, and keep trying other things. So, okay, so the obvious thing is eat less carbohydrates, but then the non-obvious thing is, try looking at seeing if fats are doing it. And I had one person in 20 years, and there may have been others that I wasn't aware of, but who he was strict on his 20-gram no carbohydrate diet, and we found out it was protein that was making his insulin go up. So he stayed insulin resistant because he was eating so much protein. He was eating like meat for every meal. And so you might look into that too. There's only 3 problems with diabetes. Only 3 things you have to avoid: carbohydrates, fats, and proteins. Other than that, you're good.
Let's try the avocado milk now. No, that's too fatty. As Meg said, they're making avocado milk now. But I really think we should do another one on osteoporosis, because there are a lot of more questions today about osteoporosis. But let me ask one question. Are there side effects to synochroma?
Side effects per se, no. Synochroma can lower blood sugar, but it won't get it too low, so you won't get hypoglycemic. It also has a good amount of vitamin D, but not enough to make you hypercalcemic. And the other things, if you had enough chromium, vanadium, and selenium, and you were to take this, the 200 microgram doses that we're giving you, it isn't enough to create any toxicity that way. So as far as side effects, not necessarily, but don't forget, anybody can react to anything. So there's nothing you can not react to. So doctors used to say like, oh, you can't react to perfumes. Well, you can't have an antibody reaction to perfumes, but you can have other reactions. So people react to smells, people react to taste, people react to any kind of chemical that goes in their body, you can react to. So the answer to the question for, can you react to anything? Can you react to broccoli? Yeah, you could react to anything. So, but are there side effects? There should not be.
Today's Fixed Blood Sugar webinar is sponsored by Synochroma, our best-selling advanced blood sugar support formula. Now, thousands of people around the world are taking Synochroma every day as part of their program to fix their blood sugar using natural ingredients that simply work. Now, Dr. Saunders formulated Synochroma to meet key nutritional deficiencies that most people have unknowingly suffered from for far too long. With Synochroma, you get a blend of 6 key ingredients. The perfect combination of chromium, vitamin D3, and vitamin K2, which it's important to take those 2 together, selenium, vanadium, and our 10-to-1 cinnamon bark extract. Now, if you're not already using Cinechroma, I highly recommend that you give it a try and see how it helps your energy, your weight, and your blood sugar numbers. You can get Cinechroma at bartonnutrition.com or on Amazon. If you get it at bartonnutrition.com, you can enter the coupon code webinar25 and you'll save 25% off at bartonnutrition.com. But I realize some people like to go to Amazon as well. So anyways, Cinechroma, highly recommend. Now let's get you back to the Fixed Blood Sugar webinar.
Okay, one last question. Let me see if I can find it. I was going back and forth. Let's see. Where's the question I was going to ask you? What is bone broth good for bones?
Oh, yeah. As a matter of fact, it is. Now, number one, it has calcium. Number two, it has magnesium. Number three, it has sodium. Number four, it has potassium. But aside from that, the bone broth, as you're boiling the bones, you are, it's called hydrolysis. You're taking out all the amino acids, and those amino acids are important for building bones. Because remember, the strength of the bone comes from the collagen, which is the protein, and that's what you're getting from the bone broth. So yeah, absolutely. You know what? I think it's a good idea. And if you've ever read anything by who's that dentist that went all over the world?
Famous dentist. Let me look.
Anyway, darn, I'm blanking on his name. If you've ever read any of his stuff, he said, you know, these places where they have really strong bones and good teeth, they have like bone broth boiling in a pot all the time. And so when they make rice, they take the bone broth and make the rice. When they make soup, they take the bone broth and make the soup. When they boil vegetables or anything, they take the bone broth and do that. And so having a program like that, it's a book called Healthy Traditions. And Weston Price. Yeah. So the Weston Price Foundation has put out a bunch of books from his research. And so, it builds not just teeth, but good bones too. It'll help. Mm-hmm. Mm-hmm.
All right. Well, you have to wrap up, don't you?
I do.
Go do with your patients. So thank you so much for Dr. Saunders.
Right.
This is such a good topic. We should do it again.
Oh, we will. See you next week.
All right. Bye-bye.
Bye.
And if you're listening to this for the first time, sign up for bartonwebinar.com to get notifications of the webinar. Come join us live. As you can see, we answer your questions and try to get to them. And we care about you, and we want you to get better and healthy, and we want to help you. So I think that's all for today. Thank you for joining us. We'll see you again next time. Bye.